Wild Health is about optimizing you. We use genomics, blood work, biometrics, microbiome assessment, many other tests, and a conversation with you to come up with a full health optimization plan. What's the perfect diet, exercise, and supplement plan for you and only you? The Wild Health podcast is about optimizing all of us. Here we cover the cutting edge science that gives you the base to be able to apply the personalized plan we give you as a patient. To sign up as a patient, go to wildhealth.com. Or if you're a physician or health coach and you want to learn how to do this for your patients, we're happy to help as well. Wildhealth.com for all the information on becoming a patient or working with us.
Okay, hey guys, this is Erin Donaldson. I'm one of the Wild Health doctors here with Dr. Julie Foucher. What's up, Julie?
Hi, we're back in action. I'm excited to be doing this with you again.
Yeah, for sure. So we've been getting some questions on birth control and hormonal contraception through our Instagram and from some of our patients. So we thought we would cover this in today's visit. Just a number of questions that y'all threw at us are really, really great questions. And we'll throw in some other information as well while we go through that. So this is a super common topic that comes up because I feel like a lot of women are either on hormonal contraception just kind of reflexively because maybe they had period problems or acne or used it for contraception. Maybe they've been on it for many years. You know, I don't think it's uncommon in even my personal group of friends that were on birth control for maybe as many as like 15, 20 years. That's for it's not super uncommon. So I think these questions come up a lot. You know, people just realize they've been on the pill for a long time. And then they're like, oh, wow, are there health consequences here? You know, is this good for my body? Is this bad for my body? What do I do when I get off the pill? What's going to happen to my period? So I think this is a really, really common thing that comes up in women's lives, especially in their, you know, late 20s or 30s when they maybe start thinking of building a family. You know, or they're just kind of curious what's going to happen in their period when they go off the pill. So I like this subject, and we'll kind of break down some of the science of it.
Absolutely. And it's such a common subject now in patients. And like you said, so many people just have been on it for so long, they don't really even know what their normal periods are like because they're used to being on the pill and maybe thinking about starting a family or fertility, or they've heard of other people having fertility issues after coming off or having, you know, severe symptoms after coming off the pill. And so it can be a scary thing to face. So that's what we're going to try to talk about and cover today.
Sweet. So first question is a pretty broad one from y'all. How can birth control impact your health overall? So one thing Julie and I were talking about is, you know, we don't want to vilify this because birth control can be super empowering for women to be able to have, you know, a little bit more control and say in their family planning. Which is amazing, you know, and that can offer a lot of choice. What is important to me is just to make sure that that choice is an informed choice, like a fully informed choice, which for me, you know, my personal history with this, I went on the pill when I was probably 15 years old. And, you know, I don't even remember why. I think I had painful periods or irregular periods, and I was like missing school, you know, things like that. And so this was just kind of told to my mom and myself that this was the best medical solution. And we just kind of didn't even question or think more of it. You know, and not to, again, vilify the physician, you know, that was really a well-intended situation, I'm sure, but I think it's a really common scenario. And I had no idea till I was even past medical school, quite frankly, that there were some of the health ramifications that do exist being on the pill, especially long term.
Right. And I think you bring up such a great point that you didn't even know this past after going through medical school and being taught about this, because I think one of the most, you know, you talk about not vilifying doctors, but most doctors, I certainly didn't learn about a lot of, you learn the basic risks in medical school, but not a lot of the risks. But also, I think we don't learn a lot about other or alternative methods of family planning in medical school. I think that there is a tendency to focus on the pharmaceuticals or the devices or things that have money behind them. And so I certainly, my eyes were opened a lot when I was in residency, and I learned more about some of the fertility awareness-based methods and how effective they can be. But they're just not offered really in practice. I think about it kind of like most doctors know, diet and exercise is important for patients for things like high blood pressure, cholesterol, and blood sugar, but oftentimes it just gets brushed under the rug because they have this sort of belief that, oh, well, patients are not going to be successful in doing that, so I might as well just jump to the drug. And I think that's a similar type of mentality that I've seen for family planning as well, that it's always like, well, those methods just don't work or they're not effective, so we're not going to talk about them, even in the right patients who may be really empowered to use things like that.
Yeah, what's interesting is that with fertility awareness or natural family planning, I mean, the rates with good use, if you're tracking your cycle, are pretty good. And what's interesting with birth control is we think about the perfect use scenario, which is really effective, but like how many women, I mean, I know when I was, I wasn't using it for contraception at that age, but like when I was young, was I taking it at the same time every day? Was I thinking about, if I was ever on antibiotic, that it wasn't working, like these things that can be effective. Like, I think it's very hard to ask an adolescent or someone in even their 20s to take a med at the exact same time every day for full efficacy. Like it's not the easiest thing to take anyway.
Totally. And yeah, you make a great point. Even in typical use, a lot of these methods are more effective than condoms, which is, one of the most commonly used forms of birth control. So I love the topic that you brought up of just informed consent. And I think that there is so much that women don't know or that doctors don't know, and that we don't learn about in our traditional medical school training in order to be able to really empower women with their full risks and benefits before deciding to go on birth control.
Yeah, for sure. So speaking of some of those risks, so I think, I make up a story that the listener that asked, how does it impact your health, probably had some fears that there were some negative implications. And we do get asked this a lot at Wild Health, or I can speak for my own patient population. I have a lot of women coming to me as patients, and they've maybe been on the pill for a long time, and they're concerned, is this impacting my underlying health? Granted, a lot of our patients are a little more holistic minded, so they're probably thinking about those things, but I do want to run through what some of those potential risks are. And it's not necessarily a small list, so I don't mean this to scare people, but there are some definite ramifications. You can have the ones we probably did learn about more formally in medical school, especially with estradiol or estrogen containing birth control methods or hormonal contraception. You can have increased risk of blood clots, and therefore increased risk of things like heart attack and stroke. In some people, you can have increased risk of breast and cervical as well as liver cancers long-term. One thing I didn't realize, and this is close to my heart, as many of the listeners may know, I address a lot of autoimmune disease in my patients. That's, a huge passion of mine, and it does increase risk of autoimmune disease significantly to be on birth control long-term, as well as diabetes. So I don't think those latter two, I don't remember learning about. Maybe we did in medical school, but I don't recall if I did. And then, of course, the a little more vague ones that I think a lot of women may experience from time to time. And then if there's nothing overtly wrong in testing, they may not ever get a full answer from certain doctors, is things like, digestive issues. Maybe they have leaky gut or a disrupted microbiome, energy issues like fatigue. Maybe they have adrenal or thyroid dysfunction, dry skin, hair changes, hair loss can happen on the pill or when you come off the pill. It's a common thing that you can see. Again, back to maybe thyroid or adrenal issues, right? Mood changes, significant change in libido for a lot of women. So, hormonal birth control upregulates something called sex hormone binding globulin, which our liver makes. And it's kind of our liver's way, the way I think about it is of like protecting our body. There's all these synthetic hormones going on and the body's not sure what to do with it. So it creates this binding globulin to try to like bind up extra hormones so we don't have too much. And then that sex hormone binding globulin also binds up our testosterone, which is, a huge part of our libido and energy levels and so many other things that is, important and protective even for our health, let alone our quality of life. And, this SHBG can be upregulated for years, sometimes for women, I think after they're off the pill or for a significant amount of time. I don't know what you see, Julie. I've seen women, the normal level is like below 50 for that. I've seen 500s before when they're on the pill with SHBG. So I don't know what your experience is with.
I don't think I've seen above 500 yet, but I've definitely seen a lot of elevations for sure.
Yeah. And then another common one I think is like really significant depletion of vitamins and minerals that we see frequently. Like, we'll have women come in and their B12 levels like non-existent. That's a very common thing on birth control. Folate levels, yeah, like some of these are the most common ones that we can see depleted while on the pill. And I always wonder if that kind of leads back to the gut health issues that we see.
Mm-hmm. For sure. And then there's just the most common ones that you hear about that we learned about in medical school, which is increased risk of breast cancer, cervical cancer, liver cancer, blood clots, heart attacks or heart disease, stroke, diabetes, and you already mentioned the autoimmune disease risk, which I think is a much lesser known one.
Yeah, for sure. And then some other people, gut health was asked about a few times, and it makes sense. It's a common, reason. I think people come to our clinic, and it's a common thing that people experience, honestly, is abnormal gut health. And it's definitely true that using the pill for a long period of time can impact the gut lining, and as well as your microbiome, as well as causing some inflammation with the gut lining. And there's a very significant risk from the research I looked at, anywhere between like 50 and even up to 300% increased risk of Crohn's disease, which is a autoimmune, very significant autoimmune disease. It's one of the irritable bowel disease categories, which is a significant life-altering diagnosis for people. And there's, I think, again, that's one of those things that's not super commonly talked about.
Mm-hmm. And not to say all these things to scare people, but just to be informed, every time that we, everything comes with risks and benefits, and it's all about balancing those in your specific situation. But, we can't brush these things under the rug and pretend like they don't happen, or ignore, women when they come asking questions like, okay, could this be caused by my birth control? Those are things that we have to pay attention to.
And it's also, I think, prudent to note, in the spirit of informed consent, pregnancy causes a lot of risks as well. Pregnancy is sky high estradiol levels. So like, say you're at risk of increased blood clots with birth control, you're also at increased risk of blood clots. Right. And so like, if this is your only true viable option that you feel like, some women have irregular periods and maybe it's hard for them to, do the fertility awareness method and naturally plan their cycle, or they, maybe they have an allergy to certain kind of condoms or whatever it may be. There may be limited options for that woman, and pregnancy for either health reasons or other reasons just may not be on the table as an option. And so it's just important to know, like, informed consent goes both ways, but I think it's talked about a little bit less with the risks of birth control are talked about a little bit less than the benefits in my experience.
Totally. And I think along those lines, something else that we were talking about before we started recording was just the fact that, so many women don't know how much birth control actually may be masking their underlying symptoms. So if you're going on birth control for irregular periods or acne or painful periods, then, going on birth control may take those symptoms away while you're on it, but it doesn't undo the underlying cause. And so that smoldering issue is still there, likely for many years, and it has to be addressed at some point if you want to see those symptoms improve.
Yeah, it's like going to the doctor with pneumonia and you just go on a cough suppressant forever. You're eventually going to, like, that infection is going to eventually rear its head. That's a more obvious example, but you can't just Band-Aid it forever. Essentially what the pill does, if you guys aren't aware, it's synthetic hormones, which essentially shut down your natural ovulation and your natural menstrual cycle. So it's just eliminating the symptoms without truly getting at the root cause, which may be, say you have PCOS, maybe there's blood sugar dysregulation, maybe if you have maybe there's inflammatory issues, underlying, lots of different things that can play a role in these. But if you don't address those underlying reasons why you may have irregular periods or painful periods or acne or whatever the reason is, then you're going to probably be left with those issues when you go off the pill eventually later in your life. Again, you're going to be left with the same symptoms, probably more because you're older. And also now you've added potentially some risk, unknowingly or knowingly, some risk from the pill itself. So just important, like you said, to address what's underlying.
Mm-hmm. And sometimes, the pill is obviously going to contribute to more of a state of estrogen dominance. So this state of having more estrogen relative to progesterone or other hormones. And sometimes the symptoms that you may be experiencing may also be related to estrogen dominance to begin with before even going on the pill. And those, include all the ones that we just listed that can be, or many of the ones we just listed that can be associated with side effects of the pill. But things like, mood changes, anxiety, insomnia, migraines, brain fog, gallbladder disease, breast soreness, things like endometriosis and fibroids, which are often reasons that people are put on the pill. And so, by adding more to those symptoms with the pill, it may make things more difficult in the long run. And there are so many factors that contribute. So if we're thinking, like you said, maybe there's a person who, with informed consent, the pill is still the best option for them, all things considered. We want to look at all the other contributors that can, put someone in more of a state of estrogen dominance and try to eliminate as many of those as possible. And so those are going to be things like processed food and sugar, excess weight. Fat is going to increase estrogen levels, coffee, alcohol, and then all the endocrine disruptors and xenoestrogens that you may find in the environment, whether it's in foods like animal products that are being fed hormones, or xenoestrogens in like personal care products or cleaning products, other medications. Those things are all things that we have to pay attention to.
Yeah, for sure. And on that note, Julie, I love what you mentioned, like, treat the woman individually, right? One pill is not a one size like fits all for every woman either. If they have estrogen dominance going in, they probably either need to be on a low estrogen type of contraceptive or consider, maybe a progesterone only. Whereas if you had a woman with maybe polycystic ovarian syndrome or ovarian cysts that were a significant issue, maybe a progestin only pill is really harmful for that woman. Maybe if we have a woman with a clotting disorder that we know about through their genetic screening or history, then maybe that woman shouldn't be on estrogen, synthetic estrogens at all. So, or a strong family history of breast cancer, you may want to be a lot more, conservative and go on a progesterone only. So even within the realm of hormonal birth control, I think we can be really specific, and we should be as physicians. Okay. What vitamins should I be taking if I'm on birth control and want to stay on it for preventing pregnancy? Good question.
Great question.
What do you commonly see in these deficiencies, Julie? What do you see help women in this area?
So I think for sure, B vitamins are one of the things that you think about. And just in general, if you think about, like you mentioned earlier, there's some increased risk of intestinal permeability or gut inflammation. That's going to affect absorption of a lot of these vitamins. And so, ones that we're commonly checking for, B vitamins, I commonly see being low. Vitamin D. You also always want to think about supporting just minerals. Magnesium is one that I think I probably supplemented almost everyone anyways, because we're all so deficient, but especially in someone who's on birth control.
Yeah, for sure. And then, most of these can be tested for, right? Not every woman needs the same kind of B vitamin, depending on their methylation genetics. They might need a different type of B12 vitamin to absorb it and use it appropriately. We can check levels on you to determine how low you are versus, are you doing okay on that one? So we can cater not only the right kind of supplement, so you're not just spending hundreds of dollars on supplements every year, but you're on the ones that really, really serve you. So I think getting personalized, which is probably something you hear us say annoyingly often, but we're in precision medicine. I think everybody should be dealt with really individually.
That's such a great point. And, taking a lot of these blindly, like you said, at best, you may be just wasting money, but at worst, you may be potentially, causing yourself worse symptoms or harm if you're supplementing the wrong type based on your genetics, or just over supplementing something that you don't actually need.
For sure. I mean, I have not a small amount of patients, just as an example, of B12, which is one that we commonly supplement when women are on the pill, that come in on B12 already, and they're just taking whopping doses, and they might have like 2,000, and like, you are going to pee out the excess. Like, it's not the end of the world, but a lot of those people, that might be contributing to like an extra stimulant effect or anxiety, or, getting some separate symptoms from really, really high B12 levels. So it's just, none of these things are benign, and just everybody should be dealt with really, really individually. And usually it's not like you have to be on, you don't have to get lab tests like every 3 months. I mean, we can get an idea of what you need pretty well with a set to see what you do well being on for a reasonable amount of time.
Right. That targeted, personalized approach is so important. Okay, so this is a question about birth control's impact on the brain and whether omega-3s or cognitive optimization can help to offset this.
So, really cool question. Birth control can definitely influence the brain in tons of different ways. Not sure exactly what this person meant by impacts on the brain. Some ways that I think of are, like you mentioned, Julie, mood changes. Like, there is shown to be an increased risk of anxiety and depression with people on the pill long term. There also can be a dampened response to stress. Again, back to that adrenal health, like a dampened cortisol response. So there's kind of like a little bit of a blunting effect is how I kind of describe seeing this, as well as, the impacts of the changes of the microbiome and all those other things we talked about, disruption of blood sugar, like these impact our mood and our way of thinking and our cognition as well, right? So again, back to the individual approach. The omega-3s are a good question. And I thought about this when I read through this question of like, is there a role directly for omega-3s on the pill? And I think so. I don't know that it specifically depletes that. I can't answer that. I'm not clear on that, but I do know that omega-3s are going to help support brain health. They're going to help support lower inflammation. They're going to have lots of impacts powerfully on the body, and we certainly can measure people. So there is a role there. I just really don't think this is a quick fix situation, unfortunately. I don't think, because you have, changes in your mood or changes in your mental health or whatever it may be based from, after being on the pill for a long time, that omega-3s are going to like solve this. Unfortunately, I don't think it's going to be that.
Yeah, I think that, again, the targeted approach of knowing, okay, if you're someone who has low omega-3 levels and you may need to increase, your fish intake or your supplementation, then maybe that's appropriate. But again, with the supplements, I think these are all things that are supportive, but if we're not addressing the underlying cause, the supplements aren't going to fix everything. So it's all, it takes approaching this from many angles, but we want to always be trying to address the root of it.
And like, just take a step back at some point, right? If you are treating symptoms of a symptom, like if you're on birth control to treat symptoms and then that gives you symptoms, so you're on a supplement to treat those symptoms. I mean, we want to make sure we're taking a step back and not just playing like a giant game of health whack-a-mole here, and, making sure we're like, okay, is this worth it? Is this what I want to be doing? Does this still fit my life? Maybe the decisions you made when you were 16 years old are no longer applicable. Maybe they are, but either way, like looking at that meta view a little bit and making sure we're not running down that domino impact of like starting meds for symptoms from meds is also important, whether those are supplements or not. So I always like to have that conversation with my patients, the whack-a-mole conversation of, is this still what you want to be doing? And if so, like, great, I'll help you support you doing that in the healthiest way possible. But if not, then let's have that hard conversation now and not just kick it down the road to deal with that underlying root issue later, because that's just made harder.
Absolutely. I love that you brought it back out. I think that's so important to keep in mind because you can really get lost in the weeds. And I love this analogy it comes from one of the originators of functional medicine, but they talk about if you have a tack, if you stepped on 2 tacks and they're stuck in the bottom of your foot, you can just walk around with them and take a bunch of ibuprofen and, kill the pain. Or even if you take out one of the tacks, you're still not going to have a noticeable difference in the pain that you're feeling, and you're still going to be on the ibuprofen. So sometimes it's looking for, what are those tacks, whether it's maybe it's the birth control that really started a lot of these symptoms and leaky gut, and now you've got nutrient deficiencies and you're kind of playing catch up there, or maybe there are, other things that you have to address. And so that's why taking that personalized approach and working with someone to figure out what those are. And sometimes it takes time to figure them out and then allow your body to heal, but it's going to usually serve you well in the long run. And then it promotes health in your whole system. So not only are you feeling better now, but you're, likely reducing your risk of other chronic diseases later on.
The added benefit of reduction of all-cause mortality, basically.
Right.
When we fix inflammation and blood sugar and HPA axis and microbiome and all these things we're talking about, like you fix your overall health too along the way. So it's the harder upfront conversation and processing, but it's like you gain in every area. So, okay, cool.
Mm-hmm.
So next question. So these two kind of go together. So someone asked, how long does it take for birth control to get out of the system? And then someone asked, are there ways to get it out of your system faster? So I felt like those.
I love that. And I love how, we were just talking about how, you have sort of a two-step approach when you have a patient who comes to you who says, okay, I want to get off my birth control. Like, what are you thinking about and what does that process look like?
Yeah, for sure. So the first question, how long does it take for it to get out of your system? I mean, quickly, if the question is how long do the actual hormones take, it's however long the half-life of, depending on what meds you are on and how your detox systems work. So it's pretty quick, but I think what this person probably really means is like, how long does this impact my body? How long does it take for me to bounce back and have a normal cycle? That's kind of how I took it. So, I think that really varies from woman to woman. I've seen women get pregnant the first cycle off birth control before they even have, before they even bleed, before they even have a technical full menstrual cycle, they ovulate. And I more commonly have seen it last probably 4 to 6 months before they really have a regular cycle. Some women, they're more than a year out and they don't have a regular cycle back. So it really depends on the woman. I think it depends on the state of health going in, and like that two-step approach that I typically use. If a woman comes to me and they're like, okay, maybe they're a fresh patient with us and they have some elevated inflammation numbers and some nutrient deficiencies, and maybe they have some insulin resistance, and they're really still working to get some of that foundational, approach made. Sometimes we're like, okay, maybe we really work on this foundation for 2 or 3 months and really get some of these numbers optimized, so you have a better chance of not completely rebounding and yo-yoing with your symptoms. And really, it can be really like defeating to feel tons of symptoms when you go off the pill. So sometimes you gotta optimize things. Some women just want to get off the pill right away and rip that Band-Aid off. And then you can still do it that way too.
You just push through. Yeah.
Yeah. But I would say, I don't know what your experience is. I would say most of the women that I've worked with will experience at least some symptoms when they go off the pill. The common ones I think are acne and hair loss that I see women experience. But sometimes their periods get a lot more painful. Those underlying reasons why they may have started in the first place do tend to kind of come back to haunt them, so to speak. But they're not forever.
Yeah, absolutely. I love the approach of just, let's try to set yourself up for success. Let's make sure that we can restore as much health to your body as possible, so that when we, remove that variable, it's primed to be able to adapt really well and as quickly as possible. But obviously, like you said, some people want to just go for it and then clean it up in the process, and that's fine too.
Yeah, for sure. I think, it can really help if you have a doctor you trust to kind of handhold you a little bit. If you're totally blind, if you're like listening to this and you're like, how do I know if I have insulin resistance? How do I know what vitamins to be on? Like, how do I know why? I have no idea why my periods were painful. I just knew they were painful, so I started on the pill. It's nice to have some data going into this, so what lifestyle changes to maybe incorporate to make this easy for you. There's great books out there. I know Julie and I both love Dr. Jolene Brighton's work. We were talking about that book before we went on. She has a book called Beyond the Pill, which is really nice. And then we, of course, can always like help take care of you or direct you to the right doc to, do the right kind of testing to where you can test like what are ways to make this an easier process for you.
Absolutely. Yeah. And there's certainly are always, you can do this from every end of the spectrum, just like everything else. You can the easiest way, or not the easiest, but the kind of lowest hanging fruit way, is just focus on optimizing, cleaning up your diet, eating real food, getting enough sleep, doing things to manage, your stress and feed your parasympathetic nervous system, getting regular exercise. And then, we can get more specific with that the more we know about you, whether that's labs, whether that's wearable data, whether that's your genetics, and getting down to that level. The more we know, the more we can try to personalize and optimize what that looks like for you.
Perfect. Okay, next question, Dr. Foucher. Do people need to detox from birth control? And is there any impact on the liver? And do they need to detox the liver specifically after using birth control? So these are super smart questions. I love our patients.
I know. I love it. And something that I think is so important to talk about, and something that, again, I felt like was sort of scoffed at when I was in medical school. If you hear the word detox, it's like a lot of people think, okay, that means I'm going to go on a juice cleanse or like do something very extreme. But when we're talking about detox, like that's not really what we're talking about. We're talking about, just supporting your liver with the nutrients that it needs to be able to do its job. And it is really important after stopping birth control because of how taxing it is on the liver. And like you mentioned already, Erin, how much the liver starts overproducing sex hormone binding globulin. And so, one is considering to check your liver function tests, like see how your liver is functioning, but just incorporating basic things that are going to help support detox function. So making sure that you have good ways to eliminate toxins, which is through sweat. So, working out, getting in the sauna, making sure you're having regular bowel movements, which is one of the main ways that we eliminate toxins. Just movement in general is going to help support your lymphatic system and blood flow. That's going to help. And then, thinking about, okay, how can we offload any additional toxins that we don't need so that our liver doesn't have to deal with those, as well as the birth control. So those are things like alcohol, processed foods, environmental toxins, like we mentioned earlier. As much as you can eliminate those, you're exposing yourself to in personal care products, makeup, foods, coffee, cleaning products, trying to eat organic when you can to avoid those pesticides. And we really love the environmental working groups, Clean 15 and Dirty Dozen, to help kind of guide on that process and what foods are most important to eat organic. Another one is avoiding, I think that gets overlooked a lot, is avoiding eating out of plastic, and specifically like heating up your plastic in the microwave, which is definitely going to increase sort of toxins that you're exposed to. So eliminating excess toxins, but then also, giving your liver the micronutrients that it needs. So that's all of your good, cruciferous vegetables, really high quality proteins, fats that are healthy, things like your omega-3s and wild-caught fish, olive oil, avocados, lots of good hydration. You can think about other sort of spices and foods like garlic or turmeric, which are going to be helpful as well. So, it doesn't have to be a juice cleanse, but it just can be, let's look at foods that are going to be really nutrient rich, supporting detox, make sure I get hydration, make sure I have all my pathways open to eliminate toxins as I'm going through this process of coming off the pill.
For sure. Cleanse is such a cringy word for me. I struggle with
Me too.
Be like a non-cleansing thing. The way some of these are designed, it can be so harmful. And even doing these detoxes, I think it's worth noting, too intensely, if your body's not used to it, can really stir up a lot of crap.
Mm-hmm.
I mean, it can stir up a lot of actual toxins that the body may not be ready to be resilient against. So in people, especially when they're doing things like sauna or true detox, like supplements or protocols, to really start low and go slow. Because you can have like a Herxheimer reaction or like some type of reaction where your body has like all this like stirred up stuff that it then has this big inflammatory reaction to. So we want to like individualize this and start small. I mean, a lot of people aren't moving every day. They're not sweating every day. They're not pooping every day. Like I think we take for granted that these things you mentioned are our body's natural ways of detoxing safely. And When it comes to environmental toxins, I used to like not think about the subject at all because it really stressed me out because I'm like, oh,
Right.
touch
It's overwhelming.
and I don't want to live in a bubble, or like I tell my patients, like, our goal is not to like wrap you up in like bubble wrap and into the world. We want you to like enjoy your life and not take away every good thing. But the more and more women that come to me, especially with hormonal concerns, especially when they're trying to optimize fertility, toxins are a really important part of the conversation. And I usually start by saying, just look at what you have every day as like something that could touch your life every single day in your home, and start with those products. And maybe you just start with your personal hygiene products first, paraben free, are they phthalate free? Maybe you just start with, you get rid of all fragrances in the house, like Glade plugins, for the love. Like, can we get rid of Glade plugins and like scented candles that aren't made with essential oils, like things that can be super, super harmful that I never learned about until like 6 years ago, probably. Things like plastics, like you mentioned, can you swap your Tupperware for glass? Can you swap your coffee maker instead of putting water through heated plastic every day for a French press? That can be like one touch changes for some people that can really, really make a difference long term. And then maybe you have an air filter and then a water filter the next year when maybe you have money to, but you don't have to do it all at once. And some of the things that touch your body all the time can make a bigger difference in my experience. And that's a good place to start without getting like so overwhelmed, at least like I used to get.
Totally. I agree. And it can be one of those things where it feels so overwhelming that you don't want to do anything because it seems like such a big project, but every little bit makes a difference. We're talking about, it's sometimes also hard to believe that these things really can have that effect on us, but once you see it and you see the power of, food, you see the power of changing your environment a little bit and how that affects symptoms. It is real. And so one thing I did was just, when you run out of a product, like I ran out of my, dishwasher soap. So then I looked on, I love the EWG has this healthy living app that rates products and their cleanliness. And so I would just look up on there, okay, what are some good dishwasher soaps, and then buy a new one. And then when I run out of my laundry detergent, I did the same thing. And next thing you know, after a year or so, you've replaced a lot of the products in your house. So that's one way to go about it.
Yeah, super smart. Some supplements can be helpful for detox support, but I would really, really, not to like harp on this and annoy everyone, but really recommend personalizing these because they're not going to be for everybody. It's going to be really dependent on like what's your hormone state going in, what do your genetics look like here, what's your liver health look like, are these even safe for you or beneficial? But things like liposomal glutathione, NAC, DEM, milk thistle, dandelion root, like lots of things can be helpful with liver support and different types of detox, just depending on the patient. Okay. How can someone go about getting off birth control? And are there ways to offset the side effects of coming off of birth control? Kind of just talked about that, but maybe anything to add?
I think that's really, it's that two-step method of first trying to make sure you have a good setup. Your body is as healthy as it can be beforehand if you are able to do that, and then support the detox function as you're coming off. And then I think also just tracking, like knowing ahead of time, like you said, that you're probably going to experience some symptoms for a time period, and just being prepared for that. And maybe using that as a way to just be curious about it, pay attention, maybe tracking your symptoms, starting to track your cycles so that you can monitor sort of where you're at in that process.
I love it. So similar question, what are other methods for regulating hormones if my traditional doctor has recommended birth control to help with something like PCOS and I don't need it for preventing pregnancy? So great question. This is exactly what we've been talking about. So with the example of PCOS specifically, you want to make sure, like you probably went on, it would be my guess, for something like acne or hair growth or irregular cycles or pain from periods. So specifically you want to really hone in on PCOS with blood sugar regulation. That's not the only issue. There's been some talk of like, people with PCOS have insulin resistance and it's the only cause of it. And it's kind of controversial. I don't think that's the only cause of PCOS. I have plenty of patients that had, maybe they just have PCO without the syndrome when they ovaries are hyperstimulated, but they don't have the full syndrome and they may be insulin sensitive. So it can get really nuanced. So I don't mean to say like, people only get PCOS who have had, diets that support insulin resistance or whatever it may be. And it's very important to regulate blood sugar to control PCOS, period. So that's, I think, the number one thing that I would share. And then blood sugar regulation can come back to lots of different things. Like, is your gut, imbalance? What does your HPA axis look like? Does your cortisol through the roof? In which case it's going to be really hard to regulate blood sugar. So, we want to look at all these different things and peel back the layers. And then someone asked about endo at some point in one of these questions too. And I think the biggest thing with that is probably like PCOS. I really, really look at blood sugar regulation. Endo, I really, really look at underlying causes of inflammation for those women and estrogen dominance.
Absolutely.
Cool.
The next question was a great one. It's about cycle syncing workouts on birth control, and is there still a role for that, especially if birth control is making you skip your period or you have an irregular period? And so I think this is a really great question. I think that, just as Erin said earlier, hormonal birth control is going to shut down your natural cycle, so you're not really able to truly sync your workouts. But I think that, as we always talk about, just being mindful, like listening to your body, listening to your intuition about what you need, no matter where you are at in your cycle, I think is a really important approach. And there's, a reason that if your body's telling you something, usually there's a reason for it. And so paying attention to when you may need more intensity or may need more recovery is helpful. But if you're not on birth control, cycle syncing is, I think, gaining a lot of attention lately, as people are tracking their cycles more. And it's something that, can be really helpful, and just paying attention to where you're at in your cycle. If you're tracking and whether you're in that early, like first couple weeks of your cycle before ovulation, that tends to be when you have the most, energy for intense workouts. So that's going to be like your HIIT training, maybe heavier lifting during that time, more energy. And then during the luteal phase, that second half of your cycle before your period comes, tends to be more of a time for more restorative exercise. So things like yoga, Pilates, walking, even some light strength training. That's a good time to do that type of exercise.
Yeah, you want to think like estrogen stars the first half and progesterone stars the second half. It's kind of how I remember it. But estrogen like increasingly goes up and peaks before, both hormones are going to be pretty low when you're on your period, and women are often like pretty low energy for a couple of days, and that can be really normal. And then that energy is going to like progressively increase until ovulation, because estrogen peaks right before ovulation and actually triggers that LH peak. Estrogen is going to go up, which is going to trigger LH to peak, which is going to trigger ovulation. So, as that estrogen goes high, women are like, oh, I can conquer the world. Their sex drive is high. They want to do all the workouts. They want to create their new business. Like, it's like this very cool, like superwoman time of the cycle. And then progesterone being high, I used to find really annoying, quite frankly, because like the luteal phase was like, I'm all relaxed and like more like calm, and progesterone is a very relaxing hormone. It's quite frank, like it's quite literally like preparing your body for pregnancy every single month, and preparing for that like receptivity of a pregnancy every single month is what our cycle is doing. And so it's like, it literally raises your temperature, it raises your heart rate, it calms the body down. It's a relaxing hormone. So I think once you embrace that, there's like a superpower in that. And there's plenty of things that can be done during that time of the month that are like so beautiful. The slower pace of life I've found is just as wonderful, but it just takes a little, in my personal experience, getting used to.
Absolutely. It's those ebbs and flows and the kind of the yin and yang, but being able to just get excited about it, how amazing we are as women that we have, these different cycles, and we can take advantage of them for different types of activities. Cool. Well, I think the last major question was really about alternative methods to birth control. So let's say, okay, we've sufficiently scared you with this episode and potential risks, and you are thinking, okay, I really want to look for alternative methods of birth control. Erin, how do you consult patients on those?
So totally depends. So someone asked about male birth control. That's an easy one to answer. basically condoms or vasectomy unless I'm missing anything. And one is very impermanent and one is very permanent. So that's going to really, really depend on your family dynamic or your personal preferences. So I would just, like, regardless of what you choose, I think you need to be really in touch with what your needs are and what you want, especially for potential future fertility. Another thing that I think can really make a difference is, are your periods regular? Are your cycles regular? Because I think if you're not regular, like, the fertility awareness method can be a lot more difficult to know when you ovulate. So that's another thing I ask women. But the options are, there's a lot of non-hormonal options. Like, you can do the basic things you learn about that pretty much everyone knows about, which are condoms and withdrawal method, which have probably the highest failure rate of any type of birth controls used. Even with perfect use, they're, between something up to upwards of 10% failure rate, even with great use. So that's pretty high failure rate in a year. There's, the copper IUD is non-hormonal. So that's an option that's really high as far as efficacy, and, very low in unintended pregnancies with perfect use. And IUDs, I think, are a lot safer than we once thought they were. I think if infections aren't a risk, they're pretty darn safe, honestly. If you aren't using condoms and there is a risk of especially sexually transmitted infections, they can be a lot more problematic and a lot more dangerous, because you have like a way of getting that infection into the uterus, basically, with your IUD. The other thing with the IUD, a lot of women go on the pill for painful periods, and that copper IUD specifically works through basically inflammation. And so it can cause, in my experience, like, fairly frequently, like, heavier and a little bit more painful periods for women. So it's not always the most appealing for that reason. And then obviously the one, you talked about, which is FAM method, or fertility awareness, your natural family planning, is like super rad for women, especially if you're like tracking your cycle, or, there's even, I had a woman with PCOS that was going off the pill the other day, and she was like, how do I know if I ovulate if my periods are irregular? And you can do that too. You can check your temperature, like an Oura ring or an Ava bracelet or a Whoop band, and know when that temperature rises. You can say, like, okay, if my baseline temperature has risen, I ovulated most likely, and I am now in 14 days probably going to start a period, because the luteal phase is 14 days. So there's still ways to do that through that as well.
And I think that what we're seeing so much more interest in these types of methods now, especially as you mentioned with the wearables and the technology that makes it easier. I think, for a long time without these, it was like to have to remember to take your temperature every morning at the same time when you first wake up and make it consistent is kind of hard. But now I know a lot of our patients use the Oura Ring, and they even have an integration with Natural Cycles, which is an FDA approved app. And so, there's a lot more, again, empowering women with their health information, and just using this, like, not only is it a method to think about you can use for pregnancy avoidance, but you could also use it for fertility planning. So, using these methods, there's a lot higher success rate of pregnancy within the first year versus just, kind of random trying. And they also help you to empower you to understand more about what's happening in your body, like knowing, okay, I'm in my follicular phase, or I'm in my luteal phase, or does it seem like I'm not ovulating this month, and why? And especially if you partner with your doctor in interpreting that data, it can help you identify even more underlying causes. So I think, I'm excited about more women, learning about these methods, and they're becoming more talked about and more widely available.
For sure. I think, well, at least I thought when I was young, before like biology and med school and all these other things, I think I thought you could get pregnant all the time. I think that's kind of the way it was taught, to at least where I grew up, and learning now that, like, literally the egg is there for at most 24 hours of a 28-day cycle is insane to me. But, like, that's truly when you can get pregnant. Now it's a little bit variable, because sperm can live for, maybe up to 6 days or so. So
Totally.
You want to know about a week before you ovulate that you're still in that, quote, danger zone if you really don't want a pregnancy. But it's not as big of a window as you may think, and there's ways to track this. Like, I have almost all my women, when they go off the pill, track their period with, the app you mentioned, or Flow is another good one, and then consider some kind of temperature tracking as well, so they can know when they ovulate. And then you can even get more specific. Like if you're going off the pill to get pregnant, as an example, or because you want to get pregnant in the near future, you can track your hormones at home now very effectively. Just ovulation strips to test for LH peak, but you can check, like I love both Mira and Anito. I put patients on that not infrequently now with home hormone tracking. And I have some women that are like, they're perimenopausal and they're doing home hormone testing. They don't want to get pregnant. That's not the point. They just want to know what's going on with their cycle, and like, are the changes that they're employing helping? Is the thing that with their day-to-day, is that helping their hormones? And then do they feel better? So you can get all this personalized data at home in the privacy of your own home, and know how your cycles are changing month to month, which is very empowering for women, I think.
Very empowering. Yes. I think a great note to end on. I think just, again, bringing it back to celebrating, how our periods and our cycles are this amazing fifth vital sign, and we can learn so much about our health from them. And so being mindful that if we are on hormonal birth control, that's going to affect, our ability to listen to some of those signals, but it can be useful in certain situations. We just want to make sure that women are informed about their risks and benefits and all of their options. And if they're deciding to come off of hormonal birth control, there's some things we can do to make that process a little bit smoother.
Cool. Well, we really appreciate y'all's amazing, intelligent questions per usual, and keep them coming.
All right. See ya.
Thanks for listening to the Wild Health Podcast. If you found it helpful, give us a 5-star rating and write a review on iTunes. It really helps the podcast, and we greatly appreciate it. If you want to be a client or you want to work with us, go to wildhealth.com. Thanks again.